Welcome to Community Health Heroes, where we spotlight local leaders and organizations that provide much-needed health and wellness resources and information. Our hope is for everyone in our community to strive to live healthier, happier, and longer lives. I'm your host, Leslie Snedowski. Thank you for joining us. Mardi Gras is upon us, and during all of February and March, we'll be enjoying parades, balls, and eating lots of king cake. But Mardi Gras is not all about dressing up in costume and catching sparkly beads. It's actually a pretty dangerous holiday, and that's why we invited Dr. Shelly Swindler with Ochsner Health Center to join us to talk about staying safe and healthy during this pre-Lenten season. In the past, we've been lucky enough to feature local nurse practitioner Sophia with Daughters of Charity Health Centers. Recently, she's been named President-elect of the American Association of Nurse Practitioners, the largest and only full-service national professional membership organization for nurse practitioners of all specialties. In our Community Health Heroes report, we'll catch up with Sophia and learn more about the growing nurse practitioner trend. And in the kitchen, chefs Max Eaton and Alex Anderson will be joining us from Maxwell, New Orleans to prepare some soup, salad, and hummus, some yummy and healthy alternatives to look for this Mardi Gras season. So don't go away. We'll be right back with more Community Health Heroes.
Hart, what's going on?
I'm leaving.
Why? What did I do?
Not enough. You constantly ignore me. You barely eat anything healthy. You're half as active as you used to be. The pressure is just too much. I quit.
Okay, I get it. I'll do better. Just, please, don't leave.
Okay, but remember, if I go, you go.
Listen to your heart. Don't let it quit on you. Uncontrolled high blood pressure could lead to stroke, heart attack, or death. Get yours to a healthy range before it's too late.
Welcome back to Community Health Heroes. Did you know some consider Mardi Gras to be the deadliest holiday in Louisiana? When you mix the more than 1.4 million revelers who usually pack themselves into New Orleans with large amounts of alcohol, drunk drivers, sharp parade throws, tons of trash, and giant parade floats along crowded streets, it could lead to a recipe for disaster. With us now is Dr. Shelly Swindler, a primary care doctor with Ochsner Health Center, Driftwood, to tell us how revelers of all ages can stay safe and healthy this carnival season. Thank you for joining us today, Dr. Swindler.
Thank you. Thank you for having me.
And happy Mardi Gras.
You too.
Mardi Gras is such a fun time of year, but it's also super, super dangerous. Tell us about some of the biggest type of injuries that you see during Mardi Gras.
Absolutely. So it can be a dangerous time. And some of the most common injuries that we see are sunburns, concussions, and eye injuries. I'd really like to start today by just talking about some general rules for safety. And I know some of this will sound like common sense, but you know, sometimes we forget those common sense things when we get wrapped up in the excitement of a celebration like Mardi Gras.
That's for sure.
First of all, you want to make sure that you stay well aware of your surroundings. You know, if you're going to the parade rounds to watch a parade, there's going to be lots of traffic there. There are lots of people, lots of vehicles, lots of floats. So need to be aware of what's going on around you so that you don't accidentally collide with one of these things.
And also barricades, you have to watch barricades.
Right. So you need to respect those barriers. They're put up for your safety. You don't want to go past them for any reason, even if you see some tempting beads or doubloons out there in the street.
I've done it.
Right, you've got to leave those be because you don't know what float or what next object is going to come down that street. Even if you see something tempting that's underneath a float that's not moving, just leave that there. It's really not worth the risk because we don't know what kind of moving parts are under there.
That is very good advice. And I think one of the other things you need to tell people about to keep things in perspective, right? I mean, those beads may be fantastic, but what, you know, are they worth the trip to the ER?
Exactly. So we want you to go out there and have fun, but at the end of the day, this is a celebration. It should be a fun and happy time. It's really not worth risking some sort of injury to go after those really nice beads.
You mentioned sunscreen. What do you recommend?
So I recommend that people bring sunscreen with them to the parade grounds and reapply that frequently. You want to nice sunny day for your parade, but with that comes harmful UV rays from the sun. So reapply frequently, and also think about seeking some shelter in a home, under a tent, or under an umbrella for part of the parade.
That's good advice. But of course, Mardi Gras changes a lot when you have kids in tow. So I know a lot of the rules change when you have kids, especially for safety precautions. What do you advise parents to do when they bring kids to a parade?
Well, I'm glad you asked that. I actually have a 16-month-old daughter, so I'm very keen on child safety. There are quite a few things that you can do. I think first off, it's important to take a photograph of your child that day before you go out to the parade grounds. And that way you have not only a recent photo, but a photo of them in what they're wearing that day in case you become separated from them. You can also have a conversation with your child before you go out there about what to do if they get separated from you. Have a meetup place, have a time to meet up again in case separation does happen. And then have a designated adult who's going to be watching out for that child or those children, just like you would have a designated driver if you went out in the evening.
How about ladder safety? I mean, you see rows and rows of ladders. For the most part, the parents are leaning on them so they look like they're stable. But that just looks scary. I mean, what do you recommend telling parents about ladders?
That's a great question. I see those often used on the parade route so that the children can see the parade and hopefully get some nice beads, right? But they can be dangerous if not used properly. Some things that you want to do if you're going to use a ladder, first of all, you want to make sure that the legs are all even and sturdy and on level ground. You don't want a wobbly ladder with your little one above. You also want to make sure that they have a safety bar in front, preferably along with a belt that can snap them and hold them in place. And finally, you don't want a child who is too large for that ladder up there at the top, because that is going to make it wobbly,
it's kind of top heavy, right?
Exactly, and unsteady.
So you're enjoying Mardi Gras, either at a parade or a ball or just on Bourbon Street, and you might be tempted to have a Mardi Gras carnival cocktail or two. Mm-hmm. Talk about overindulging during Mardi Gras, because a lot of problems, the serious ones, have to do with drunk driving and alcohol-related incidents. What do you recommend to people? What do you tell people about Mardi Gras safety when it comes to alcohol?
Right, that's an excellent question. Some of the injuries that we see are caused by alcohol, probably most of the time caused by alcohol. Particularly, we see a lot of concussion injuries from falls caused by alcohol. So if you're going to drink, if you're of age and want to drink responsibly, that's okay to do, but make sure you drink plenty of water along with that alcohol so that you prevent yourself from becoming dehydrated.
I think I remember there's some sort of ratio, like 2 bottles of water for one beer or something, is that right?
Right, I usually tell people 1 to 1. So if you've had an alcoholic beverage, now's the time to take a break and have yourself a bottle of water.
Now, another thing to help too is to eat, but also you don't want to overindulge either, especially if you have a chronic illness. I mean, if you have diabetes, you don't want to go out to a Mardi Gras party and eat all the king cake available. What do you tell people about, how do you advise people about not overindulging in food during Mardi Gras?
Right, so our holidays here tend to be packed with really great food, so it can be a particularly hard time if you've got a medical condition like diabetes and you're really trying to stick to your appropriate diet. I think there are 2 things that you can do. One is before you go out to watch a parade or go to a celebration, have yourself a light snack at home, a light snack that follows your dietary guidelines, and that way when you're out there watching the parade, you're not starving and you're not tempted to eat those unhealthy foods. Another thing you can do is actually pack some snacks for yourself.
That's a good idea.
So you're going to bring your own, right? If you have diabetes, they're going to be low sugar, low carb snacks. Throw them in a backpack and bring them with you out to the fairgrounds.
I also, this is kind of a drag when it comes to Mardi Gras, but life still goes on. You might have a fitness routine or some sort of, you need time to rest, to recoup. How do you fit all that in during Mardi Gras? Would you recommend someone to stick to a fitness routine during that time?
Absolutely. So you really want to stick to those things that are making you healthy and are good for your overall general health. So you don't want to put those aside. You really just want to say yes to these Mardi Gras events that you really and truly want to go to. Don't feel bad if you want to say no and take a break and rest, or go to the gym and get some exercise in. Because we want you to have fun at Mardi Gras, but we also want you to stay balanced and practice self-care.
That's very good advice. If our viewers want to learn a little more about Mardi Gras safety or where to go if they get injured, where can they go?
Any of our Ochsner websites, ochsner.org. will be helpful for you.
Great. Well, Dr. Swindler, thank you for spending some time with us, and have a wonderful Mardi Gras.
Thank you. You too.
When we return, local nurse practitioner Sophia Thomas would tell us why NPs are becoming a more popular and practical alternative to seeing a doctor in our Community Health Heroes report. We'll be right back.
Cost of family time activities getting you down?
Hello, I'm Dr. Spruce. If you or someone you know needs a healthy dose of nature, visit discovertheforest.org to find out which park or forest is closest to your family.
Acorns are not real currency, but that's okay because parks or forests are either free or super affordable. It's a truly economical way for the whole family to enjoy each other's company and bond beyond the confines of concrete buildings and rush hour.
Did you know, according to the American Association of Nurse Practitioners, an estimated 270,000 nurse practitioners are licensed to practice in the United States? That's a jump from an estimated 248,000 NPs in March of last year, and is substantially higher than the estimated 120,000 NPs reported in 2007. DNP Sophia Thomas, with our local Daughters of Charity Health Centers, has been named President-elect of the American Association of Nurse Practitioners. So who better than her to tell us about the growing trend of nurse practitioners in our Community Health Heroes report. At the Daughters of Charity Health Centers, nurse practitioner Sophia Thomas is the primary care provider for 1-year-old Bianca. As a nurse practitioner, Thomas provides primary, acute, and specialty health care to patients of all ages. Daughters of Charity Health Centers has a patient population of more than 50,000, making it the largest community health center in Louisiana. And Thomas stands at the forefront of a growing healthcare trend.
There's a need for nurse practitioners because there's a primary health care shortage, and access to health care is an issue. You hear stories about people waiting to see their primary care provider sometimes 2 weeks, and they're having acute illnesses. Right now we're in flu season, and if a patient is sick and has flu-like symptoms, they really need to be able to get seen in a timely manner. Certainly at Daughters of Charity Healthcare Centers, we pride ourselves on same-day appointments and giving people that access to care. But there's been an increase overall in the need for nurse practitioners to meet that primary care need that's not being met on a national level.
Thomas practices at the Daughters of Charity Health Centers at 3715 Williams Boulevard in Kenner, and has been named President-elect of the American Association of Nurse Practitioners, where she helps lead an organization representing 270,000 nurse practitioners that handle an estimated 1 billion patient visits annually.
It's truly an honor to serve in this capacity. AANP is the largest professional membership organization for nurse practitioners in this nation. Certainly nurse practitioners are positioned to help us solve the healthcare problem of access, cost, quality for our patients, and I'm truly honored to be in this position to help spearhead that forward as the momentum continues.
It takes about 4 years to become a registered nurse. After several years in the field, RNs can apply to nurse practitioner school. There, they can earn master's and doctorate degrees in about 4 to 6 years and apply for NP certification. Today, 87% of all nurse practitioners in this country practice in primary care.
Certainly nurse practitioners are going into areas that sometimes physicians don't want to go to. We have a lot of nurse practitioners in the rural areas. So access is definitely an issue, and we pride ourselves on providing access to care for people that would otherwise not be able to have it. Certainly you could see a nurse practitioner for any healthcare issue that you see you would see a physician for. Obviously, we don't provide brain surgery, but if you have hypertension, if you have diabetes, asthma, if you're ill, any acute or chronic primary care condition where it's within our scope of practice to treat, and we pride ourselves on treating and then going a step further, looking holistically at your education and being sure that you understand your disease process so you're better able to take care of yourself or your family member and have better outcomes.
Nurse practitioners are not mid-level providers and are expected to meet the same standards of care and competencies as their physician colleagues. They treat the same diseases, and Thomas said their clinical outcomes are equal to and sometimes better than physicians. The 10 Daughters of Charity Health Centers in and around New Orleans offer behavioral health services, chronic illness care, dental, optometry, pediatric, primary, preventative, and prenatal care, and on-site laboratories and pharmacies.
This profession has been extremely gratifying. I've been a nurse practitioner for 23 years, and I've practiced in a variety of settings, mostly in the primary care spectrum, from rural health to community health centers. And I have to say that my relationships with my patients, getting to know them, not only their disease and their disease process, but getting to know their family and really looking at them with a holistic approach has really what's made a difference in my profession in the way I practice, but it's had an impact on the patients and their family members. And it's nice getting to know them, not as patients, but as people. And that's probably the most rewarding thing.
When I was 6, my days were spent playing basketball. When I was 6, my dream was to make it to the NBA. When I was 6, my mom had a stroke.
I'm Paul George, and I want you to spot a stroke fast.
F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911.
Protect the ones you love.
Spot a stroke fast.
I'm Molly Kimball, registered dietitian and founder of Ochsner's Eat Fit NOLA. We've collaborated with more than 100 partners locally to create Eat Fit NOLA, a partnership that highlights the better for you items right there on a restaurant's menu or on grocery store shelves, making it effortless for you to dine at your favorite restaurant or shop your favorite market without ditching your otherwise healthy diet. Every month, Community Health Heroes Show, which is sponsored by the United Health Foundation, will shine a spotlight on an incredible chef to help show you how you can make smarter food choices to live a healthier, happier, and hopefully longer life. In addition to Eat Fit NOLA, you can find our partners such as Eat Fit North Shore, Eat Fit BR, Eat Fit Bayou, and coming soon, Eat Fit Acadiana in a neighborhood near you. So don't go away, Community Health Heroes will be right back.
It's Mardi Gras season, and let's face it, who wants to eat healthy when there are so many Mardi Gras treats to eat? From king cakes to fast food and party food to lots and lots of alcoholic beverages, it's really hard to stick to a sensible diet when all you're doing for weeks is celebrating having fun. But at Maxwell New Orleans, you can find some tasty and healthy alternatives this carnival season. Joining us now are chefs Max Eaton and Alex Anderson and Eat Fit NOLA registered dietitian Lauren Hulin. They're here to prepare some soup, salad, and hummus. So thank you all for joining us today.
Yeah, thank you so much for having us.
Happy Mardi Gras.
Thank you.
So why is it so hard to eat healthy during Mardi Gras?
Oh gosh. Well, I think there's a lot of different reasons. We're out on the parade route, and you know, there's all the vendors there. There's the corn dogs and
so much temptation.
All that stuff. Yeah.
All the temptation all around you all the time. Not only during Mardi Gras season, but seems like a lot. And that's kind of how Eat Fit NOLA came to be. We want to let everyone know that there are healthy alternatives. And we partnered with Maxwell New Orleans. And they're an amazing restaurant. I'll let you speak to that.
Thank you so much, yeah. You know, I guess during Mardi Gras and the rest of the year, one of the easiest ways to stay healthy is to cook things yourself at home and then bring them out with you. And so today we're gonna show you guys how to make a hummus, a seed cracker, and we'll display one of our healthy bowls, our salad bowls.
Wonderful. And this is all stuff that you can actually take to go too, right? When you go to your restaurant in Magazine Street, you can take it to go and kind of snack during a parade if you had to, so you're not tempted by the pizza and everything out there.
Absolutely.
Yeah. So in terms of hummus, it is amazing. I had no clue there are so many ingredients to making hummus. Do you want to step us through what we're going to be working with today?
Yeah, absolutely. So we have here our Robo Coupe, because this is what we mix our hummus in. We have to pulverize the chickpeas.
That is a serious looking machine.
Yeah, all duty, all purpose.
Can you use a blender? Like if you're at home trying to make this?
Yeah, you can use a blender or a smaller food processor. You know, we're a full service restaurant, so we definitely try to make larger portions.
Yeah, absolutely.
So those are the chickpeas.
Cooked chickpeas we have, we've soaked these overnight and we cook them, but if you don't have that kind of time, you can use a can. Of course, you know, the healthier way is to do it yourself, but.
And Lauren, I can imagine you can tell us a lot of good things about chickpeas, right?
Oh, they're incredible. Not only are they packed with protein, but they have fiber too. So you always want to try to get fiber, fat, and protein every time you eat, and that's exactly what this hummus dish is.
So what else do we have that we're going to put in there, Alex?
So we have our tahini, 3/4 cup of tahini.
This is a very popular sauce.
Tahini, yeah, that's sesame based, right?
Yep, sesame seed oil, right?
I remember at health food restaurants when they were first starting to be mainstream, everyone had tahini on faux burgers. Everyone's like, faux burger with tahini sauce.
We also have lemon juice. Lemon juice, nice acid.
And you can start smelling it now too. Ooh.
Then we have our Himalayan salt.
Pink salt, that's right. A little bit easier sodium.
That's pretty.
It's not processed.
2 tablespoons garlic minced. Some nice garlic flavor.
Pre-cut up. Chop it up before you put it in there.
And 2 tablespoons cumin.
Oh,
That's
an interesting.
right.
Is that the secret ingredient?
It's one of them, I know. We're giving away all the...
And instead of oil, which most hummus base has, we're doing stock.
That's right, yeah.
That's awesome.
It keeps the flavor in there, but also keeps it oil-free, which is something people don't always think about with hummus.
Added protein. So is that a bone broth, or do y'all make your own broth? Or
It's a veggie stock, actually. So
Okay.
at Maxwell New Orleans, we're
Oh,
totally plant-based, yeah.
Yes.
So we take our scraps and boil them down and steep them
That's
into
awesome.
into our stock.
What do you recommend if you go to Maxwell New Orleans? Would you say just like what are the little containers? Those like half a pint or a pint or?
Yeah.
So they actually have small and large portions, right? 4
That's
ounce
correct.
and an 8 ounce.
That's right, 4 and 8 ounces.
And both would
And
be
both
okay?
are EFIT approved because they are making it themselves. You saw how much salt went into this large portion, not a lot.
Yeah.
Right.
So, yeah, but if you're buying your own, buyer beware.
Right. Salt is a preservative, so it's in a lot of the store-bought foods.
So if our viewers are trying this at home, if it looks like it needs a little help, you put some more stock in to make it a little smoother?
Add more stock.
So Laura, when we're talking about portion sizes, what about nutrition-wise, like calorie-wise? What are we looking at there?
So with their 4 ounce portion, it's about 200 calories. So not bad at all. And normally you are sharing this dish. And their homemade crackers are really, really amazing too.
Thanks, Lauren. I appreciate that. Yeah, I wanted to show you guys a little bit of our seed cracker mix here, which is also a non-oil or an oil-free recipe. And you can see in here, if you can, we've got pumpkin seeds, sunflower seeds, flax, sesame, chia, and ground chia. And basically, we put it all in this bowl, and the chia seed and flax seed acts as a congealer. Pour it on in there.
It looks so pretty in the container.
I know.
Right, I just mix it up together. And we add to that our spice mix, which is garlic powder and onion powder and a number of other spices.
And crackers, I take it, are EFIT approved too, because I mean, it's not really bread, it's just a cracker, right?
Right, and all he's using are seeds.
That's it.
That's it. And a cracker, and I'm assuming you baked it.
Yeah, we bake it after, after we mix this together. We'll flatten it out onto a baking tray and cook it in the oven for about 20 minutes at 350 degrees. You can flip it over and cook the other side. And you let it sit like this, and it'll start congealing after a while and become a little bit more solid. Takes about 15 minutes.
And after you just like roll it like in a flat pan or something? Is that what you do?
You put it out on a baking sheet, and kind of maybe line the baking sheet with a Silpat, or you could put a little bit of oil on the bottom if you're into that. And you flatten it out like it was a large cookie, but thin. And throw that in your oven for about 20 minutes, and you'll come out with this kind of cracker-like granola.
It's so impressive. I'd love to go to a party and say, yeah, I just made these. Because they look really beautiful. Very gourmet. And I know you also have some soup and salad to show us too. These are items you also serve in that
Yeah, this is kind of our more popular items. We've got our banh mi bowl and our tomato soup here. And I'll let Alex show you the ingredients that we have in here to assemble
I don't
it.
recognize some of these things here.
Here we have just fresh avocado.
Got that.
Which we put on.
That's pretty. But it's this pink thing. Is that shredded?
This is pickled vegetables.
Okay, pickled vegetables.
And what do we have in there, Alex?
We have shredded red cabbage with shaved carrot, shaved radish, and shaved cucumber. We also have our brown rice base seasoned with sesame and tamari.
My gosh, this is a lot of food. What's about the portion size here and nutrition value? I mean, is this very caloric?
Yeah, so everything that is Eat Fit approved is going to be below 600 calories, but their bowls and salads range around 400 to 500.
Wow, that's a lot of food for that. And you're not even done yet.
Mung bean sprouts. We also, we keep the dressing on the side. We have a sriracha aioli, so I'll just stick that guy in the middle. And then we garnish with our cilantro and our shaved fresh radish.
I'll tell you, that looks like it'll keep you full for a very long time.
Oh, yeah.
Absolutely, and that's one thing that I love about Maxwell New Orleans is that every ingredient is so wholesome and nutrient dense. So even though it might be 500 calories, it's 500 calories that are gonna give you fiber, fat, protein, and a ton of micronutrients to just keep you fuller longer, to help your organs function correctly, and just to be more vibrant with everything that you're doing.
Oh, you need a lot of energy to do fun stuff during Mardi Gras. And the last thing, real quick, is the soup. And is there any sort of special things you want to tell us about the tomato soup?
Sure. Our tomato soup, I mean, we make everything in-house fresh. We use our veggie stock. And our tomato soup, we roast the tomatoes first in the oven. We roast them with garlic and some shallots. You can actually roast the tomato whole and put your garlic, a whole garlic clove inside the tomato so that it doesn't burn and overcook. So it kind of makes it a little bit more simple. You put your tomatoes in the oven till they're nice and brown and the skin starts coming off. We then put it into a blender or a food processor with stock and a little bit of balsamic and cashew cheese that we make.
So what sets this apart is that it's not heavy whipping cream that's going into this tomato basil soup. So it's actually very wholesome, very, very good, and plant-based.
Yeah, that's right.
Tell us a little about Maxwell. Where can we find out more? Where are you located?
Sure.
Where can we find out more about you?
Yeah, we're on 6101 Magazine. It's Magazine in Webster, uptown by Audubon Park. And you can check us out on Instagram at Maxwell New Orleans and online on our website, maxwellneworleans.com.
That's easy to remember. And Lauren, how can we learn more about Eat Fit NOLA?
Awesome. So you can visit our website, eatfitnola.com. We also have our Instagram at eatfitnola. And we're everywhere. Every social media, visit us, connect with us. If you have any questions, eatfitnola@gmail.com, and I'll be sure to answer them for you.
Well, great. Well, thank you, all of you, so much for coming, especially during this busy Mardi Gras season, showing us some wonderful alternatives. And we're going to be posting all the recipes to all these items on our Facebook and our website, communityhealthheroes.org.
Thank you
so thank you. We'll be right back.
Marie, you have prediabetes.
Prediabetes? I don't have time to eat right or exercise. I'm a busy mom.
Oh, you're a busy mom.
Yeah.
This is great news. Busy moms never get prediabetes.
Wait, what?
Let me just... Yeah, this is all the people at risk for prediabetes, and way over here, busy moms. No? Whew.
Thank you for joining us. If you would like to suggest a health topic, send us information on your health organization's events, or recommend your favorite Eat Fit NOLA restaurants, please visit our Facebook page or email us at communityhealthheroes@gmail.com. If you'd like to learn more about our guests and share segments from our show, check out our website at communityhealthheroes.org, and you can also find our show on YouTube. We hope the information we've provided you about Mardi Gras safety, the services local nurse practitioners can provide, and how to eat healthy during Mardi Gras at Maxwell New Orleans will help you and your family live healthier, happier, and longer lives. I'm your host, Leslie Snodowski. Make sure to join us next time for more Community Health Heroes.